I think there is an incredibly dedicated group of faculty here at this institution that really devote themselves to enhancing knowledge of learners.
We all love to teach, and I know the thing that I love to teach is teaching the residents how to put things together in a story that makes sense, and then being satisfied that they have the story that describes the patient, and then moving on from there.
There's a long-standing history in Denver of training emergency physicians. It's not that we rest on our laurels, but we have had decades to, I think, figure out how best to do it.
I think it gives us a tremendous opportunity to teach people the things that they can use later on when they practice.
Teaching is one of the hallmarks of being in an academic environment for emergency medicine. My favorite thing to do is to teach medical students and residents the value of taking an accurate history and performing an accurate physical examination.
The milieu in the department is excellent for teaching. We really value medical students, we value education. We put that at a very high level, and we have a very diverse faculty and a diverse patient population, which makes it a wonderful learning environment.
When I think about teaching or mentoring, I think it's about forming a relationship with that learner and understanding that we're not just conveying facts, so this is how you calculate an acid-base disturbance, or this is how you interpret an EKG. We're not just teaching procedures. This is how you put in a central line, or this is how you IND an abscess. What we're really doing is showing learners the pattern of how to behave, because so much learning is mimicking. So the obligation is greater than understanding the content or being able to demonstrate a procedure. It's really being comfortable with someone patterning themselves after you, taking a piece of you and a piece of someone else, and realizing how important that is and what the downstream effect is, because learners will remember their interaction with you for the rest of their careers, and that's an important obligation.
The hidden part of being a faculty physician at an academic institution is that you're really learning as much from the learners as they are learning from you.
For me, and I think for most of my colleagues, mentoring is what keeps us going.
To me, that's one of the most powerful aspects of being a mentor, being an educator, is having a content area that you feel passionate about and have expertise in.
The Department of Emergency Medicine is unique. We have mentors in all the fields who are nationally regarded, whether it's research, whether it's toxicology, operational medicine, the business side of medicine, education. We have faculty in our department who are respected locally as mentors in and out of emergency medicine, as well as across the country for these different fields.
I think that one of the most important things for students is to push against the pressure that you get these days for tempo and for seeing as many patients as you can, because that leads to sloppy medicine. So actually pulling up a stool, looking the patient in the eye, and taking a deep breath and focusing just on that patient is something that you're not going to get rewarded for, but which I think is the essence of being a good doctor.
I tell students that hard work beats talent. Talent is great, but to really do their best, they need to do more than bring what they have when they get out of bed. They're going to have to really work hard, persevere, and finish what they start.
To me, that's what I try to impart on my residents, on my trainees. It's not about the lab test or even potentially the diagnosis, although it's important. It's really about how you interface with the patient.
What I tell trainees is that you can never know too much. Your obligation is to know, to read, to understand. Although there's a lot that goes into being a physician, an important part of being a physician is knowing. And part of knowing is knowing what you don't know. So spend more time with the patient. Ask more questions.